Hi, I'm Lawson Koeppel. I'm with Virginia Harm Reduction Coalition. We are a harm reduction agency that operates in Virginia and Southern West Virginia, and wanted to talk to you today about the program that we had, thanks to Prevent Cancer Foundation, which is addressing Hep C, which is a rising problem in folks who inject drugs, which is the highest transmission rate right now for Hep C. Next slide. A little bit about us. Virginia Harm Reduction Coalition, as I said, we operate in Virginia. We have an office in Virginia Beach and in Roanoke, Virginia. Our mission is to improve the health of our friends, really. And we do that by shifting resources to the folks who have intentionally had those kept from them. A lot of that is folks who use drugs and the paraphernalia laws that prevent folks from accessing the sterile things that folks need in order to not transmit Hep C, HIV, give them in other infections. Let's go to the next slide. So a little bit about our services. We have a day drop-in center, which a lot of folks who don't have houses come in and use, charge their phone, take a nap. In addition to that, we have wraparound services, benefit enrollment, overdose education, HIV testing, and peer support for folks. So what does that look like? We just wrapped up 2020, and I have some of that data here. We have 1,200 people enrolled in our services. We got 42,000 doses of naloxone out. And you see the test results there for Hep C, and we'll talk a little bit more about that program in a minute. Next slide. So what does Hep C treatment have to do with cancer prevention? When we look at hepatocellular carcinoma, we're looking at a pretty deadly cancer. 2-year mortality rate at 50%, 5 years at 90%. The reason why we want to focus on Hep C is because the transmission rate, or the transition from hepatitis C to hepatocellular carcinoma is 17 times more likely for folks. Of course, we talked about the population with the highest rate of hepatitis C, and that is currently people who inject drugs. It's the number one transmission rate. And when we look at the other reason to do this, when we look at the modeling with hepatitis C, as long as we can get medication-assisted therapy and wide coverage syringe programs and antiviral treatment, we can cut rates of hepatitis C from 50%, and I've seen it as high as 80%. Wanted to talk specifically about our location. It's top left there, you can see the hepatitis C burden throughout the state. And as you see here, the largest burden is in Southwest Virginia. Roanoke City, where we're based, has about a 350 per 100,000 rate. I believe the rest of the state has something close to 20 per 100,000. So it's obviously a burden in the rural areas. Below that, you can see instances of infectious diseases and where they rank in the state. It's probably pretty hard to read on the right there, but the top line is hepatitis C. Has been, always will be, and we can address it with a comprehensive approach. Next slide. So what are the results of what we accomplished? So we went through and had community pop-up events, had folks in the office during our outreach, and did the rapid hepatitis C tests. We did about 322, which was, I think, about 100 less than we had submitted for the program. And we'll talk about the reason why we didn't hit the number in just a second. About half of those folks had Hep C or were reactive to the antibody test. And the reason why that's lower than some of the citations in the prior slide is because we hosted community events where folks who weren't necessarily part of the people that we serve were coming in to get tested, and we welcome that. We, as I mentioned, we had 1,200 people enrolled in VHRC services. We were able, with each touch point, we talk about transmission and ways to reduce harm. Obviously, we're a harm reduction program. And so part of the materials that we transfer those folks is education, and that's a big part of it. In fact, I think the most common question I get about Hep C is if I can give it to myself. And that question sounds silly, and it is naive but the reason for the question is it's so ubiquitous in the community. People just think you develop it from injecting. So the getting folks into treatment proved difficult due to COVID-19. We had 12 folks make the first hepatitis C clinic. I think the first 2 hepatitis C clinics. We hosted one in the New River Valley and one here at our office in Roanoke. As you can see, the drop off, we had about a 50% completion rate, which honestly isn't bad. Trying to work with our folks can be tough. Most of them don't have phones. If they have phones, they probably don't have minutes. If they don't have minutes, they probably don't have access to a Wi-Fi source where they can get through that. So that, I think, played into our ability to get folks into treatment. In order to open up the treatment capacity that we also found when trying to get folks into treatment, we helped found the Virginia Hepatitis Coalition. It's a group of folks, medical professionals, community health educators, people who use drugs, who are setting about to look at the systems that we have in place, to look at developing and building capacity to treat and screen for HCC and hepatitis C. So that's a big part of this program coming out of it, was getting that capacity, because capacity is tough. We have folks who wait, I think they're told to wait 6 months before they'll be able to get into the clinic. All right, next slide. There's my contact information. I always say, we love you, be safe, carry naloxone, and look forward to talking to you and answering questions.